Did you know one of the top predictors of a positive outcome in therapy is actually the quality of the relationship between the client and the therapist? That's pretty mind-boggling. That is why I'm such an advocate of doing a consultation with your potential new therapist so that you can get a feel for what they're like. You can ask questions. So huge advocate for that. Recently wrote a blog post about 18 questions you can consider and or ask a therapist that you're considering working with. And I think a good therapist is going to be open to that because they're going to understand the importance of you feeling like this is a good fit for the client and also for the therapist. So a few questions that I would definitely ask is, do you have experience working in this area? So if you are somebody who has trauma, which sidebar is all of us. If you're somebody who has trauma, you want to make sure that your therapist has some sort of framework for working with trauma. If you're wanting to do couples counseling, I especially recommend in this case couples counseling that you work with someone who is specifically trained to do couples counseling, because couples counseling is vastly different than doing individual therapy. If you have a child and you're wanting to work with parenting, does your therapist have experience working in those types of dynamics, those types of relationship dynamics? Do they have experience working with children, or do they have experience working with parents in the parent-child dynamic? These are types of questions that are really important to ask. I would also encourage you to ask, hey, what types of modalities are you trained in, or do you like to use? That's also really important. Here at Ethredge Counseling Group, we use what is often called bottom-up approaches instead of a top-down approach. A top-down approach is more of that like strict CBT type approach where you're really thinking about like, what are your thoughts? Labeling your thoughts, challenging your thoughts. It's very thought focused, which of course is important. Of course, thoughts are important and our relationship to our thoughts are important, but our thoughts are only a very small part of who we are as human beings. We have our whole subconscious mind, subconscious thoughts and awareness. We have our nervous system, we have our body. So we work from a bottom-up approach, which is a more holistic approach, understanding that our body is a complex system that's more integrated. So for example, trauma, if you're somebody who has experienced trauma and you're wanting to address that in therapy, trauma doesn't live in the conscious left brain analytical mind. So a CBT approach may not be a very good approach for you if you are experiencing trauma triggers, because a lot of that is subconscious and a lot of that has to do with the nervous system in the body actually. Many people are familiar with the book, The Body Keeps the Score. That's a great book if you've experienced, well, it can be triggering to read that, so maybe I won't just recommend that to everybody, but in that book, I think Van der Kolk does a good job of communicating the importance of working with the whole body, not just the left brain or the analytical brain or the thinking thoughts brain. Anyway, so check out 18 questions to ask your new or potential therapist or counselor over on the blog. And yeah, I'm curious too what questions you personally like to ask. And I'm also curious if you've had resistance from therapists when you're asking these questions. But I think it's good to know if you have a particular area that you're struggling with, to ask them about that. Also kind of gauge their willingness to dialogue with you about that. Certainly our feelings are never hurt if you say, hey, I'm not really feeling like this is a good fit, because that's so important. And I might not be a good fit for every single person out there, of course. And so we absolutely don't take that personally. And I think no good therapist is going to take that personally if you communicate like, hey, I don't really feel like this is a good fit, or I'm actually looking for XYZ. That's really important to know. I think we can certainly be too picky and kind of use it as an excuse to avoid really getting into therapy. Because because you certainly don't need a perfect therapist. You just need an adequate therapist. The really important thing is, do I feel safe enough to be able to tell them anything? That's a good barometer. Now, that might be work of internal work that you need to do if you're struggling to do that. But generally speaking, is this somebody who I feel like I can tell anything, because that's crucial. That's the crucial thing. So yes, the relationship with your therapist, feeling like it's a good fit, is important, and got a list of questions that you can start asking.